Health matters. Simple tips for better living.
Hello, my name is Kathy Lambert. As a former school teacher of 16 years, I want to make sure all children are well prepared to succeed in school and in life. The experiences I had in the classroom have been helpful in my role as chair of the King County Law and Justice and Human Services Committee. Here I have the opportunity to share information about how good vision is fundamental to learning success. As you know, most students are screened annually with a basic spelling test for 20/20 vision at a distance. However, they rarely test for a host of other vision skills, such as close vision and tracking. School screenings typically detect only 5% of all vision problems. In the average classroom, 20 to 30% of students may have a vision problem. Undetected vision problems can be a serious barrier to students learning at their best. When I taught 5th grade, I saw firsthand the changes that vision correction made for many children. Some never had seen properly and did not even know that they could not see completely. Some did not know that letters were not supposed to be moving around the page. Research indicates that undetected vision problems may be at least partially responsible for behavioral problems as well as academic challenges. At the King County Juvenile Detention Facility, I sponsored a pilot project in 2005 to screen incarcerated youth for vision problems. What would you guess is a percentage of students with vision problems? The screening found 80% of the children had undetected vision problems. What a shame these problems were not detected earlier. Many kinds of vision problems reveal themselves in behavior and attitude. I'd like to thank Dr. Mary Baker, a behavioral optometrist at the Overlake Vision in Bellevue, for sharing some signs that can indicate vision problems. Here are over a dozen potential signs, and when you see 3 or more of these, it's time to have the child go to an eye doctor. The list includes: were they squinting when looking up from reading? Were they frequently blinking or rubbing their eyes? Were they having headaches while doing schoolwork? Were they frequently awkward or bumping into things or knocking things over? Were they holding books extremely close to their face? Were they spending a long time doing homework that should have only taken a few minutes? Were they having a reduced attention span? Were they covering one eye and leaning on their hand? Were they laying their head on the desk when writing? Were they frequently losing their place when reading? Again, if several of these symptoms are detected, I found these children came back for an appointment with the eye doctor with new glasses. The children were glad to have these vision problems detected, so they knew why reading had been difficult for them. They saw optometrists who tested them for visual function, as well as eye health and visual acuity. One day when my granddaughter was 2, I observed her playing and realized she showed some of these signs. That day, I also watched her lack of interest in pictures as I read her a story. We took her to the eye doctor, and she was soon wearing glasses. Today, she's an avid reader and a good student. I am so thankful we took her to the eye doctor. Catching vision problems early can make a big difference in future success in school, work, and life. With stronger vision skills, children experience improved grades, better self-esteem, and more positive relationships at home and school. Thank you for all you do to help detect and correct vision problems.
Health matters. Simple tips for better living.